Hello and welcome to the Concerta Care Group. I'm your host, Philip Day. Here we discuss addiction, recovery, and treatment for people looking to make a change. Our guest today is Edith Ogunsanya, Nurse Practitioner with the Concerta Care Group, Baltimore, Maryland. Good morning, Edith.
Good morning.
Edith, please tell us what you do at the Concerta Care Group in your position as a nurse practitioner.
What I do at Concerta Care Group is provide addiction treatment to clients that come in through our doors. We assess them, try to find what their needs are, what their drug of choice is, and we focus on the opioids and find a treatment plan for them. We offer through either buprenorphine or methadone treatment.
Okay. Edith, how did you become involved with Concerta Care Group's recovery and treatment programs?
I've been with Concerta for about a year now. I became involved because of my interest in helping people. People with addiction have a stigma in the society that it's a moral failing. However, my view of addiction is a brain disease, and with appropriate treatment, guidance, and counseling services, our clients or the patients can succeed and attain whatever their level of success is.
Well, opioid addiction is our topic today, and that I know you're an expert in that. First, though, would you introduce us to exactly what are opioids? What are classified as opioids?
So opioids are pain pills like Oxycodone, hydrocodone, morphines that are generally used to treat pain. However, people that were prescribed the opioids may become addicted to it. So let me rephrase that question. So essentially, opioids were introduced for a positive reason to help treat pain, to help people recover from surgeries, broken bones. However, with the addiction portion of it, is people now depend on the opioids to get the euphoria, even though they don't have any pain. They still use the opioids.
Well, considering what you've just said, though, how would you define an opioid addiction?
So an opioid addiction is, like, give an example, would be Percocets. Okay. You have a prescription for Percocets. You had pain, correct? You had surgery. 3 days post-surgery, your pain is manageable. You don't need the Percocets to control your pain. However, you like the euphoria, because when you take the medication, you're at ease, it relaxes you, you like that feeling. You continue to take that Percocet to attain the feeling or to the state that you want to be in. That becomes an addiction.
Okay. So when someone's addicted to opioids, what are the typical signs? I'm sure there are red flags that friends and family and colleagues would see. What do you see? What have you seen as red flags of opioid addiction?
So typically, red flags of opioid addiction are if someone is prescribed the medication and you run out of your script, you go doctor shopping and you magnify your pain. For example, you have, yes, you had total knee replacement done. It's 1 month post-op, and you still feel like you need Percocets around the clock to help you move. So it's a physical, the ability to search for more, like you're always thinking about it. You're going to do something and you're looking for when next am I going to take my pill. And for some people, they actually take it more frequent. It's supposed to be every 4 hours. Then the person starts taking 2 or 3 tablets to get more effects from it.
So doctor shopping is really just kind of typical. They'll go to one doctor and get a prescription, then they'll go to another doctor and get another prescription. I've heard of that with some famous people and with others. So that is definitely a red flag. Any other red flag that other red flags that you see with someone who has an opioid addiction?
Well, some of our clients, they don't necessarily have prescription. They didn't start off with a prescription habit. They were introduced by a friend. They went to a party, and someone said, "Try this," and for some people, their brain get addicted, like wants that same feeling, and what they keep doing is chasing the drugs.
Okay.
Be it prescription, be it heroin, or any other opiates.
So as we conclude today, Edith, what would you say to someone who knows somebody who has an opioid addiction? What can they possibly do? This is a very serious problem we have now. How can someone help someone they know with an opioid addiction?
There are different ways that you can do to help someone with an opioid addiction. The first thing is to find out about treatment options that are available in your area. And you can also find out and see if there are any doctors that actually offer office-based treatment options. For example, here at Concerta Care Group, we do offer the methadone and the buprenorphine medication-assisted treatment. Encourage your loved ones to see their addiction as a disease. It's not a moral failing from their part. It is it's a disease just like diabetes or hypertension, that if you address it with the necessary resources, it can be managed. And remember, for some people with addiction, and it applies to other diseases, you have remissions, you have relapse, but if you seek out the resources available, you will succeed.
Okay. Well, as we close today, Edith, first I want to thank you for joining us for this video today. I know you've got a busy schedule, unfortunately, with so many patients, but we encourage you, the viewer, to visit our website, www.concertacaregroup.com, or call 410-617-0142 to find out more about our community-based substance abuse treatment and total behavioral health care. Concerta Care Group of Baltimore, Maryland has no wait to get into treatment, and we take same-day referrals. If you or someone you know is addicted, please get help now. Thank you, Edith. Thank you to our viewers, and have a good day. Bye-bye.
As well. Bye-bye.